Good morning, and thank you for joining all of us. Today, we are excited to share details with you as we continue to prioritize COVID-19 testing in our schools here at NOLA Public Schools. Last week, we led our community and nation in partnership with our city and leaders like Dr. Avegno to prioritize gaining resources to bring COVID-19 testing to our students and to our educators in our schools. Now, thanks to the large investment made by the federal government and the leadership of the Louisiana Department of Education, we will have regular, weekly, high-quality COVID-19 testing in our schools citywide this year. This essential tool is launching in several of our schools this week, just like here at the Net Gentilly site. Yesterday, we conducted 730 tests across 3 school sites. Through the Louisiana Department of Health program, I am so proud of the level of participation. I am grateful for the leadership and partnership across all of our schools and agencies to ensure that our students and educators have frontline access to testing to help them monitor their own health and help keep our schools and the broader community safe. I encourage all families to sign up for this testing program through your school because it is voluntary. And this morning, as I continue to talk about the test, I will remind you that it's easy to do online. Results will be sent right to you, and students will be provided cash incentive to participate every time they take the test. Testing is one of the best tools we have to combat this virus in our community. I think I should say that again. Testing is one of the best tools we have to combat this virus in our community, especially given the current state of community spread. Yesterday, we shared the most recent numbers of COVID-19 among our schools and staff. These numbers are not what we want to see, but I have to also say they are not to be unexpected. It's crucial for everyone to understand that these numbers reflect spread in our broader community and not our schools. Our schools, on the other hand, are taking all the precautions to prevent spread. They're masking, contact tracing quarantines, and testing and vaccines. We are doing all this work inside of our schools. I want to send this reminder today. We need all of our families. We're doing this work inside of our schools. We need our family to do some work outside of school. Mask up wherever you go. Avoid large social gatherings, especially indoor and especially for your children. Get vaccinated to protect yourself and your family. I am encouraged on today by the increased numbers of tests administered last week in our schools, and we need to just keep it up. 1,600 students were tested last week, and only 1.3% came back positive. This is encouraging news because we all know that in-person learning is the best education environment for our young people. Students learn best when they can be with their teachers and also with their friends. Now, I will turn the mic over to Dr. Jen Avegno, who has been such a leader for our city and nation on this topic, to talk about the importance of testing and where things stand today in this pandemic. My COO and my right hand as we continue to navigate COVID-19 through NOLA PS, Tiffany Delcourt, she will give more details about the program in our schools. And today we're at the Net Gentili, and so I'm pleased to have Elizabeth Osberg, the Executive Director of the Net Charter Schools, with us on today. And before Dr. Avegno comes up, I also would like to take the opportunity to shout out, we have Adam McElwee, one of our nurses with us here today. And this work that we're doing in our schools would never ever be possible if it wasn't for the courageous and awesome nurses that we have throughout our schools. They deserve a round of applause because before the pandemic, I will say they had young people coming to the office. Sometimes in the elementary school, you put a Band-Aid on them and they go back to class and they're good to go. Where today is a different day. And our nurses continue to step up, and they should be commended for the work that they continue to do in leading in such a time as this. At this time, I'll turn it over to Dr. Avegno. Thank you.
Thank you so much, Dr. Lewis. Thanks, everybody. Sorry about the heat. We are still firmly in the grip of the Delta surge, though there are some early signs of at least a plateau in cases, and that's positive. However, our hospitals continue to be strained. Our healthcare workers are still facing incredible challenges. Statewide, children make up about a quarter of all COVID cases that are officially diagnosed, which reflects the increased contagion of Delta, as well as the increased testing in kids compared to last year. We didn't have this program last year. And there is a little ray of light in PEDS hospitalization data based on what we're getting from CDC and LDH. 2 weeks ago, the week of the 8th, they reported 88 pediatric admissions for Delta, and this week, the week of the 22nd, they're only reporting 8. So that's a really, really good indicator. Although we know that there are many cases among kids, what really concerns us, of course, is the hospitalization. As school districts open around the state and around the country, they're seeing cases just like we are here. Again, we do believe firmly that NOLA Public Schools remain safer environments than what activities we do in the community at large, because they have mask mandates, they have highly vaccinated rates among their staff and teachers, and rigorous safety protocols in place, as well as robust testing. And this is borne out by the 1.3% positivity rate in school testing compared to the nearly 10% rate in the community. So you can see the difference. Medical public health experts all agree that in-person learning is the best educational experience for children. They can develop the social and emotional life skills by being in school. And I can say this as a parent, and I see it completely. They have accesses to resources and support, mental, social, health needs, hot meals that sometimes aren't available regularly at home. And for our hardworking teachers, who we ask so much of, there's no substitute for delivering lessons face-to-face. The contact tracing that's going on here in NOLA Public Schools indicates that students are getting COVID outside of school buildings, in their home, in their community environments, on play dates, at birthday parties, doing things with friends and family. The safety protocols that are established in schools, though, are identifying these kids, helping them isolate, and working contact tracing to limit the spread. And because of all these efforts and all of the mitigation efforts that are going on around our schools, the Louisiana Department of Health has not recommended school closures. The plan to keep kids safe and our community safe has not changed. It's very simple. It's masks, tests, and vaccine. Masks work. There is a mountain of evidence that universal masking is critical to short-term mitigation of case transmission. We are starting to see the effect of our city and statewide mask mandate on cases, and we know we need to continue this for the foreseeable future. And I'm really proud to live in a place where this is not a matter of debate. In terms of testing, as Dr. Lewis said, encouraging more students, staff, and community members at large to participate in testing is going to help us best track the impact of the pandemic. So I'm really excited that NOLA Public Schools, who I know have worked so hard on this, are going to be able to provide more. And the more we test, the more we know. The more we know, the better we respond. And it doesn't just keep our kids safe, and it doesn't just keep our teachers safe, it keeps the entire community safe. As you've heard me say many times, vaccinations are the best long-term defense to stop the spread. We continue to have a robust supply, many locations to receive vaccine, even at your schools, lots of mobile programs at schools. And I'm happy to announce that since August 12th, when our citywide mandate for certain businesses was announced, we have vaccinated an additional 3% of the entire New Orleans population. That's in a little bit over 10 days. The FDA's approval of the Pfizer vaccine yesterday is further evidence that the vaccine is safe and effective, and we hope it encourages even more people to get vaccinated. This is a challenging school year. It's a challenging start to the school year, there is absolutely no doubt. But the groundwork being laid right now in masking, rigorous testing, and aggressive vaccination efforts are going to protect us not only immediately, but for the rest of the year to come. And now I'm happy to turn it over to Tiffany.
Thanks, Dr. Avegno. And again, thank you for all you've done to advise us and keep us on the right path. Testing, as Dr. Avegno said, is one of those critical tools to keeping our students and staff safe in our schools. And we've started this year off incredibly strong with more than 3,000 tests performed in our schools in just the first 3 weeks of school, all while maintaining a positive test rate of less than 2% throughout that time, demonstrating the safety of our schools. To continue these programs and these efforts, I'm excited to share more details about the additional testing program being offered to us by the Louisiana Department of Health. Starting this week and increasing over the next few weeks and months, over 80 schools will be participating in weekly on-site testing, providing the gold standard PCR test to all that want one, all students and all staff. This is a government-funded program through the CDC, which means there is significant resources being provided to school testing citywide. And there is a funding cash incentive to our students and staff receiving these tests, as Dr. Lewis mentioned. For those that sign up to receive a test, they'll receive $25 for their initial test and $10 for every additional weekly test that they receive. These cash incentives will be made available to our students and staff via virtual e-cards. This is a tremendous resource to help keep our schools COVID-free and to help our families and staff monitor their own health during this trying time. We know that this is a tool needed given the level of community spread in our city and our state, and our schools are stepping up and encourage students and staff to participate along with all the other mitigating factors Dr. Avegno mentioned, such as masking up, social distancing, and vaccinations among our staff and our eligible students. Yesterday was our very first day of this program, and in our first day alone, we tested 730 students and staff. We know this number will only increase in the coming weeks and months. The results of these tests were delivered to families electronically within 24 hours, and we've already heard back from parents who've received their test and heard the excitement and relief in their voice that comes with the knowledge and comfort of a negative test. As more of us get vaccinated, our schools become safer, and it's the best thing we can do to keep our schools safe and keeping them safe for our youngest and uneligible students. But in the meantime, we are excited to launch what is the largest testing program in public schools in the state of Louisiana, because we need our students in school, we need them in the classroom, and we're going to provide them every opportunity and advantage to do so. So next, we're going to bring up Elizabeth Osberg, who's the Executive Director of the Net Charter Schools, which is one of the schools managed behind us, and excited to hear what she has to say today.
Good morning. Welcome to the Net Charter High School. I'm here with many of our staff and our nurse who you met earlier to reiterate the importance of testing and vaccination so we can keep our kids in school. Our young people are working, they're socializing, they have moved forward with their lives just like we have. And that means that because of that, there are large numbers of cases or quarantines in our schools. This is not because our schools are breeding COVID, it's because we've all moved forward with our lives in the community. It is vital for our children's growth, for their mental health, for their development, and for their future that they're in school every day. And to get there, that means all of us have to get vaccinated. Our staffs, our parents, and our young people. In our school buildings, at our schools, and all of our schools in our city, we're doing great work screening students, testing students, and contact tracing to make sure that cases don't grow and spread in the school. But ultimately, these are Band-Aids. We have the tools to stop quarantines in our schools, and that's citywide, community-wide vaccinations. If we all get vaccinated, COVID numbers, illnesses, and quarantines will drop tremendously. So it's really up to us to keep our kids safe in our schools. We need to get vaccinated, and we need our children to get vaccinated. Thank you.
We'll take questions at this time. Row one.
Dr. Lewis, with the approval from the FDA with Pfizer vaccine, are there any plans moving forward to issue a mandate for staffers?
So first of all, I'm very pleased with that announcement that was made on yesterday, because I do believe that many individuals were waiting on that go-ahead to feel even safer with taking the vaccine. And so I'm just very encouraging our school system that not only will more individuals actually move forward, but I'm looking forward to the day when an announcement is actually made when our youngest learners can actually also participate in being vaccinated as well.
Any plans for staffers, like teachers, principals?
So we made it very clear at NOLA Public Schools at our recent board meeting, where we have mandated vaccinations for all of our employees. We were already over 90% before that even happened, but it has been mandated. And even before the board vote on last Thursday, many of our schools made it very loud and clear that they were requiring vaccinations for their employees. And our high schools a few weeks ago have shared that if you're going to participate in extracurricular activities, that you either are vaccinated or you sign up for routine testing. So that's what we have in place, but I do know, even as now we know that Pfizer has been given the clearance. We expect some other things that may happen at the federal and state level, and of course at NOLA Public Schools, we look forward to those things happening, because we talk about the vaccination now, but we know our young people that before you go to school, there's a whole series of vaccination you have to take. So we're looking forward to the day when the COVID-19 vaccination is also added to the list.
Okay. Kenny Lopez, WGNS. We good? Any other questions? Aubrey?
I have a couple questions. Of the 4,600 quarantined currently, how many are students?
So she's going to get the data. She doesn't have that in front of her at this time, but she'll get it and we'll get it to you.
How are y'all doing on virtual learning? Do we know how many kids are currently learning virtually?
I don't have that information with me at this time as well. But what we have done at NOLA Public Schools, any family that needs virtual accommodation, they have worked directly with their individual schools to go through the process to be given the option to have virtual learning. And then you may have just recently seen an announcement by Sci-High because of operational challenges, and we made that very, very clear in the very beginning that there will come a time potentially where you have challenges around personnel that causes a school to go on virtual. And so using Sci-High as an example, they are going moving forward with virtual for a period of 2 weeks.
Are there, talk about the supplies when it comes to laptops and internet access. How many laptops have been issued? How many do you need?
Yes, so if we all can go back to March 13th of 2020, the Orleans Parish School Board allocated funds for our district to initially purchase hotspots and laptops. Since that time, our schools have been able to make purchases. In the last school year, for example, every single student in our school system had a laptop as well as connectivity. But we do know in the course of a year, just like any other school supply. Things get lost, things get broken, and so our schools had to go through a process over the summer to purchase additional equipment for our young people. And that's just not something that has happened in the city of New Orleans. If you can think across America, kids are kids. And laptops got broken. And so schools across this country have to make purchases. And so some schools, because of backlog, are waiting on those additional computers as well. But I'm so thankful on today that our schools, everything that has been thrown at them, every battle, they have found a way to overcome. And this is only the month of August. So I just ask everyone to continue to work with us. Just like last year, we got through it together, and we're going to get through this school year together as well.
Is there an estimate on how many kids are having to use like a packet because of the weight when it comes to laptops?
And you also have to look at when it comes down to a packet. You may have some students that may be on quarantine right now, and because they are probably some of our youngest learners, that initially, because school just started, that they may initially be on packets because of just trying to get reacclimated to the school year. And that's why I want to continue to make the point of that this is the month of August, and this is not your typical school year, but our principals, our school leaders, they are well prepared, and they have been responding in a very positive way to make sure that even our students on quarantine, that they have the work and the tools that they need to be successful over that 14-day period. And when they return, we continue and we move forward.
And Dr. Lewis, you referenced a school moving virtual due to some other issues. Kind of talk to us a little bit about, we are getting calls from a number of parents about bus issues. You know, there's a bus driver shortage. Kind of address that.
Yes. When you think of COVID, and I just described the purchases that we're making with laptops, and some of those things are delayed, right? Across this country, there's also a bus driver shortage, and our schools have worked with their vendors. They may not have the number of buses that are ideal for their school, but I will remind everyone that the regulations that are in place around transporting kids to and from school, all those things are being followed. And also I have to thank some of our parents, because whether it's because of the bus shortage or just the fact that they have more comfort in dropping their kid off and picking up in the evening, that those things are also happening this school year. And so it's a school community effort that we all have come together to make sure that during this very challenging time, we are solution oriented and finding ways to make sure that our kids can show up to school and be in person every single day.
All right, thank you guys so much. That's all questions for today.